Health Block Grant, the state must have a planning council. So we serve both state and federal functions. We have statutes directing our membership and our areas of responsibility in both state and federal government. You all as local mental health boards have state statutes and requirements as well. And one of them states that you are to annually review your county's performance and report your findings to the Planning Council. So most pretty much no county was doing that recently. I should mention the council has been in existence for over 20 years. I am only the second executive officer. My predecessor was in office for about 19 years.
Really?
She was a little woman with little feet but big shoes to fill. So I'm doing my level best. So what my staff and I have done is we've created what's called a data notebook. How many of you maybe remember seeing a data notebook and filling out the questions last year? Terrific. Last year was the first year we did it, and we had a tremendous response. I have to credit my staff person, Linda Dickerson. I mean, she dogged the counties to get this in, and we got something around 82% return rate, which is unheard of. So we're hoping now that there's a little more familiarity, we'll get even more. I think the counties that didn't turn it in, they were listed in our annual report, and hopefully they'll maybe get on the ball. What we do is, you know, as you all know, mental health is huge. There's a million things going on in mental health: children's services, crisis services, homeless services, housing services, ongoing. There's now mild and moderate symptoms level to be delivered by the health plan. I mean, there's just, it's a lot. So we can't have you report on everything. It's just too much. So we designed this with a couple of areas that we focus on. Last year, we really focused a lot on access and what groups you were serving in terms of penetrating the underserved groups, especially ethnic communities in your county. This year, we're looking into alternatives to locked facilities. So we're talking about jails or hospitals. And we're kind of looking at 3 phases. The council is taking this actually theme on for the year. We're looking at what programs are out there that are prevention type programs that keep people from getting to that level of crisis. When someone does have a crisis, what kinds of diversionary programs are they? When they find themselves at the doorstep of either a jail or a hospital, does the county have diversionary type programs? And for those people who did need that level of care and were institutionalized, what kinds of transition programs are available? So that's kind of what the council is looking at. So we have some questions in here. We're trying to get a sense of what kinds of services and programs are available in the counties that are alternatives to locked facilities. There's a second area that we're looking into. The council recently voted to integrate substance abuse into our work. It's going to be a long and thoughtful process, not something that's going to be able to happen overnight. I know many of your local mental health boards have integrated with substance abuse, and you're now behavioral health boards. The council is going to do a similar thing. So we're asking a lot of questions about substance use in your county and the services. We, wherever possible, we provide you data specifically about your county. So the document I handed out happens to be for Shasta County. Susan did a training a few weeks ago up in Shasta County for the Superior counties, so that, and we had some leftovers. So just so everybody would be looking at the same thing, you have Shasta County. But I will tell you, every county mental health director and the chair of every mental health board has already received an electronic version of this about 10 days ago for your county. and it has the data specific to your county. Yes.
My question, who is supposed to compile or put this together?
We're going to get there.
Well, I don't know. Tell me.
The hope is that the mental health board will.
The mental health board is going to do this?
Some mental health boards will need the assistance of the county director and information from the county department. But some of the questions, do you want to, let's go ahead and look at it.
I didn't mean to move you forward, but I mean,
No,
most mental health, I mean, we have like 15 members. Maybe those 15 members, maybe 3 or 4 are actually functional or capable of doing this stuff, and they're already busy doing other things. So then you add this to their list of things that they're supposed to do.
Well, it is a statutory mandate that every local mental health board report to us annually. So we prepare this to kind of guide, so I don't get 58 different kinds of things that I can't like.
No, the fact that you put this all together in a unified format, I have no trouble with that at all. It's just that our county staff used to do this, and they would do a pretty good job. And they walked in last month and said, "Okay, here it is. Have at it."
Okay. Well, let's look at some of the questions, and then I do want to hear from you on where you think they would be problematic. Yes.
That's one advantage I liked about going to Long Beach. A couple of months ago, that district attorney and the director of behavioral health care, they had made it so simple, and that was the first time I ever heard of mental health and the criminal justice system coming together on one accord. And what stayed with me was that they said, we must do this. It's not we're going to try to do this. And they had a clear plan to follow. And just for you putting it out there, I'm just so appreciative.
Thank you.
Because that was so beneficial, and the change to the system as being inclusive.
Absolutely, yeah. Did you have a question? Oh, sorry.
I was just want to say in Nevada County, our advisory board would never take that job on. We have our behavioral health people put all of that together, the staff. So.
Well, that's great.
And it has to be qualified people.
I think we do ask a question about that in the back. Is we're asking who filled this out, and whether you have an annual budget, and whether you have designated staff to support your activities. The Association of Local Mental Health Boards is doing a project, so they asked us to include some of those questions. And we were curious to know who was filling this out, whether it really was the mental health board or was it the directors and their staff. And so we encouraged the last page to be completed.
They brought it to the board, the advisory board, for review. But they had done the work.
Okay. Okay. Well, in the last data notebook, there were questions that we had that the county had to provide you the data for you because there was no statewide data available, no source for that. But each county should have been able to tell you that. In this one, we supply you with the data, or it should be things that maybe you should maybe already have a sense of. And so we're asking for your perspective. So for example, the very beginning section is about the alternatives to locked and involuntary facilities. And so we asked, do you have these types of facilities in your county? Now this you might need to ask the director for some help, or you may have people on your board that know this very well, whether you have institutes for mental diseases, any psychiatric health facilities, skilled nursing facilities with a psychiatric program, whether your county contracts for beds in a state hospital, whether you have a psychiatric hospital that you have beds in, It could be that you have none of those, as this gentleman from Amador County has indicated, or you may have something else that you utilize when an individual is experiencing a crisis and they need services. Many counties have crisis residential programs, and that we would like to hear about if you could put that in under other. But I could see where you might need some input from the county staff on this if your members aren't already aware of all the types of facilities you have.
What about when our county, they have the EQRO folks come and I've sat in on one of the sessions, but I know that they inspect the whole in its entirety, the behavioral health services. But I don't know what the outcomes or the report, what it says or anything. Should I have access to that?
Yeah, and I think we might provide you some information on where you can find that, because it is on a website, every county's report, EQRO report. And EQRO, though, just so you know, is limited to Medi-Cal funded services. It's a function, the federal government requires the EQRO each year. And so, which stands for External Quality Review Organization. So a third party has to come in and review the county's Medi-Cal funded programs and facilities. And it's quite an involved review. They actually scour reams and reams of data supplied by the state, which was the Medi-Cal billing data. So they get a lot of information that way. So your EQRO report contains a wealth of information. You just need to realize, though, that it's only painting the picture for your services that are funded by Medi-Cal.
Well, most, I don't know what the percentage is, but I would think most of the folks there that are getting treatment are Medi-Cal recipients. Like a very high percentage of them are.
Well, and that is one of about 7 funding sources that your county receives for mental health services. You also, as you know, receive Mental Health Services Act dollars.
Yeah.
You receive Mental Health Block Grant dollars. You receive
Okay.
Realignment 1 and Realignment 2 dollars. So we have the realignment of 1991 and the realignment of 2011. There's Medi-Cal, and sometimes you have other funds such as county local dollars. So there's a myriad of fund sources, so not everybody who comes into the county to receive services has to be on Medi-Cal. That's why they have the other services or other sources of funding.
I don't like to interrupt you again, but did you say that the counties that sent in these responses, we can tell if our county has been in there or not? I don't see it on.
Yeah, this is the data notebook for 2015. Our report for the data notebook of 2014, last year's data notebook, is on our website. I didn't bring copies of that. I didn't think to do that. I apologize. It should have been a little more proactive.
You say that I was aware of this, and when I first read that we have to send in a report, I was thinking, oh my God, I felt really ill prepared or something to take this on. But I don't know that the board has been doing this. If they do, they kept it secret from me. I just got elected as the chair, and so there's a lot of things, I guess, that I don't know.
Well, like I said, last year was the first time we did a data notebook, and now the second one has come out.
So this is for Shasta County.
Right.
Okay.
You got one specifically for your county. It should have been emailed to the chair, whatever email address you have online.
I could have missed it.
Check with the secretary of your mental health director. They should have this already.
Okay, and it's the data notebook for my county.
Yes.
And El Dorado turned theirs in, according to the website.
No, mine's San Joaquin. I'm sorry.
So you definitely.
But I know El Dorado did.
Did San Joaquin send one in?
Yes, we did.
Yeah, San Joaquin definitely did. Carrie made sure you did.
Then I don't know that, the board, chair did that or something. I mean, I don't know. It might have been from the director,
Right.
possibly.
I don't know.
It's probably kind of
Yeah. I don't, you have to check with them, I don't know.
Probably was.
I can't answer that.
Is your board chair, the board chair from last year, still on your board?
They left, no, they're not there any longer. But I know Kerry, he has, how long have you has the board been required to have submit these? More than just 1 year?
The requirement has been on
For a
the
long
book
time.
for a long time. Last year was, 2014 was the first time we did a data notebook recently. My predecessor did them years ago, but.
Yeah, I'll ask Kerry about that.
Okay, so moving on, we asked then if you don't have any of these kinds of facilities, and you have a need that goes beyond crisis intervention, how do you handle a need for longer term hospitalization? We have some options. So many of the small counties will be filling this out. Larger counties that have a lot of emergency crisis intervention facilities won't be sending folks, say, out of county or have other alternatives. Again, we ask whether you have alternatives to locked facilities, what kinds, and we give suggested, commonly known programs that might be available, but we also, if you have something else, we encourage you to let us know about that. Then we go in and ask about jail diversion programs. So we're wanting to know if your county happens to have that. And as I mentioned, those transitional programs, when someone was in, if you have reintegration, transitional services to help them back into the community and provide necessary support so they don't find themselves back in jail. Many counties might have a very creative program that they have created, such as many of you heard about Los Angeles County's program. As she alluded to at the April council meeting, the district attorney for Los Angeles County, Jackie Lacey, addressed the council regarding a new program that they instituted. Los Angeles County Jail is termed the largest mental health facility in the nation. So they recognize that a good many of the individuals going into their prison or their jail there are there because of mental health and substance issues. Jackie Lacey was an attorney with the district attorney's office and worked cases and saw people coming through over and over and over again for things that seemed preventable. It seemed like clearly locking them up for the short term that their violation called for and then spitting them out. Then they come, it wasn't working. There had to be a different way to break the cycle. So when she became the district attorney, she took a huge risk. She started with women, especially women with children, who were oftentimes just trying to put food on the table and keep a roof over their children's heads. So they were engaging in criminal activity with no other resources. She started a diversionary program, and it was a residential care that provided nutrition, exercise programs. It provided job training, therapy, substance use, and worked with the women so that they could get their children back. They had about a 78% success rate.
Wow. Good. Amazing.
It was a huge success rate, but you have to appreciate what a risk she took. So these women that should have been sentenced and gone to prison were sent to a residential facility where they could come and go. And if someone had said, I'm below this, and left and hurt someone out there, her head would have been on a platter. So it was a risk, but she knew we were doing wasn't working. We have to try something else. So a lot of counties have done that, and if you have something like that, we want to hear about it. She's now expanded it to veterans, and that's working very well. And now they're doing it with mental health, and that's why she came to us. diversionary jail diversion isn't a new concept, but for LA County to take it on, being how large they are, the numbers that they experience, it's been a great effort, and we applaud all of those. So we really want to know about that. We also know that children experiencing crisis, there's very limited resources for them. So we have a couple questions about that, because we're going to probably next year be looking more into children's services. We have new data sources that have recently become available at the Department of Healthcare Services, where services delivered to children. So you might look for that kind of spoiler alert, 2016 for children. All right. Then we move on into the integrated care. So we're talking about treating individuals with both mental health and substance use disorders. We provide you actually some information about national statistics to kind of give you some context about what the numbers look like in terms of people with mental health issues and substance use issues, and then those that have both. And that goes on for 3 pages. We also have the last page, page 13, is about children and youth specifically, because this is a growing issue in our younger population. So again, these are national statistics, and we provide you your county's statistics starting on page 15. I want to give a disclaimer. When we get these data by county, in some of the smaller counties, the numbers are so small that people could know who it is. So we lose the privacy. So for a lot of the small counties, unfortunately, you're going to have asterisks in a lot of boxes. And we ask, do not have your county supply you that number and write it in, again, because that will violate individuals' privacy in those smaller counties. So just know that that's unfortunately the reality for you all, but there should be some numbers there that will help you understand the numbers being served.
What page are you talking about?
I'm on page 15 right now.
There's no, are you talking about like a pie chart or a
It
graph?
looks like this.
It's all blank.
It's blank.
Well, it's empty. At least the
boxes are completely.
fields are empty.
It's interesting that some of the older ones of mine probably
Fields are empty.
have it.
Oh, my apologies. I
Because
thought.
we were waiting for the
They should
H2RO
have
data.
Oh,
So-
okay.
So
So for
I
a
mean,
lot
for
of
the
counties, there are
Kellogg.
numbers and percentages in there. So where it talks about service type, outpatient, detox,
Yeah, mine's all
residential.
blank.
right, but that's because we didn't have the Kellogg data when
We
we
might-
copied the first set of the.
Yeah, my apologies. We have since gotten the information, we've inserted it, so what was sent to you will have numbers in it, or asterisks.
You will have numbers
Yeah.
because you're a bigger county.
These numbers are just for Shasta.
Right,
Correct,
exactly,
yeah.
exactly.
The black and white copies have numbers in it. Those of you that received a color at the top on the front page is blank. So I'll give you this one when I'm done.
Oh, okay, okay.
So a question that I thought you all might be able to answer from your local mental health board was, what are the top 3 most abused substances in your county? Not including cigarettes, but like alcohol or marijuana, or does your people go for more hard stuff like opium, cocaine, LSD, those kinds of things? So you might have a sense of that, or maybe your mental health, behavioral health director might be able to help with that. And then we ask about what are barriers to access and engagement in treatment. These are the kinds of questions that we're hoping the members of the local mental health board can answer, that they know their people, they know their county's issues. Is it because it's so rural, there's a lack of transportation? Is it because it's a highly populated urban setting, so it's hard to get an appointment because everybody's full? What are the barriers, or you have a high concentration of monolingual, so you don't have bilingual staff, and they're not coming in because of that. So these are the kinds of things that we're looking for your guys' perspective. Sure, the mental health director can write this, but we really wanted to get your guys' on the ground reaction.
Janet, one of the issues that I see is that your first topic was treatment options and alternatives to locked or involuntary facilities. You looked at a series of questions. Mm-hmm. But the concern or issue I see is that the alternatives are typically optional alternatives for the mentally ill. So these aren't alternatives that they're required. Are they required to participate in, or are these simply options that are available should they choose?
Well, there's different kinds of crises. So certainly when someone is in crisis and law enforcement is involved, so they're being 5150, there's not a choice.
Sure.
Then there are people who are escalating. They contact the family members, might contact the county. We ask, maybe you have, what is that, the 23-hour, yep. Or you have crisis residential, a peer-run program, and that's where you can send them. Those are the things we ask about. Then we ask if it's going to go beyond crisis stabilization. So somebody might need, say, 60 or 90 days. What kinds of facilities do you have?
The issue I see is there seems to be a gap between the time where a family becomes aware that this person has had a series of 5150 calls on them. They may not be at this point in time a danger to themselves or others. However, you know this person is persistently severely mentally ill, right? And there doesn't seem to be an alternative to making sure that that person gets treatment today, so that we don't have an involvement with the jail or right prior to that. So there's this nowhere land that they land in. The families are struggling.
Tell us about that. In this, you can always attach additional pages if there's information pertinent to what we've asked, but we didn't maybe ask a question that touches on your issue. Please write that up and send it in, because we will love to include information like that where there's this gap. We have this service, we have this service really well, but
about
in
the
between,
population
that's important information for us to report out about.
So if I were to approach this, I would probably need to sit down with my director of services, because there are services that I am either vaguely aware of or don't really know exactly the stuff, but I wouldn't want to send in a data sheet that was that had errors in it. So
so I think it can be used as a learning tool.
Right, and earlier when I was talking about developing your relationship with your directors and your HHSA people, and what are those relationships? This is a wonderful time to build those relationships. It's a wonderful time to have an ad hoc committee for 2 hours, sit there with the appropriate people from the department, the form, and a small cadre of people from the board, and talk about each of these questions. And really, it can help direct your work for the coming year. Wow, we didn't see that as an issue. So take this as both a learning opportunity, a partnering opportunity, a developmental opportunity, and we're going to talk about this afternoon as far as community outreach. We were doing this. We talked about using this as the annual report, remember? Possibility. And so this afternoon we're going to take that and expand on it a little bit as far as advocacy and community outreach. But unless you have reliable data, which is what you're talking about and what we worry about a lot, and unless you have the passion around it, it's not as effective as it could be.
But in this number 10 list, there is nothing about the gaps that Yvonne just mentioned. And how does that input come in?
Like I said, you can write additional information on additional pages and send that to us.
Because I know we were just up in Truckee yesterday, and there was a woman and her daughter speaking about the brother who had schizophrenia and in and out of jail, in and out of honesty house, Turning Point, and on the streets and found in the bushes. And concerned he's going to be dead the next time.
Right.
And that's a really important thing. And also the other thing that came up was what response if the family calls and calls and calls and gets no response. So I asked the question, how many therapists do we have for the county accepting these calls? 3.
That's a lot.
Yeah, that's a lot to some of these smaller counties. We're not a big county, but it's a concern that we don't have enough people to serve the community we're addressing, I think.
So we want to know about that workforce issue.
Yeah.
I mean, that's in the general huge categories in the sky, I would call that a workforce issue, and we want to know.
Yeah.
You know, we simply don't have the workforce. Sometimes you don't have the workforce even if you have the money. In Shasta County, we have money for psychiatrists. We have locum psychiatrists that drift in, drift out, and I see lots of nods. So I think several of you are in that same.
Yeah. Hold on, I'll come right to you. Go ahead.
Shouldn't that, I think it would be more effective if you go to leadership and behavioral health care, to the directors, to people that allot out money to these services so you could get the correct data. And plus, this is valuable information. That presentation that attorney did was, and it's not, I want to do this, I'm doing this, so this is factual.
Right.
And it would, the county is in a situation where they have to be, they're trying to be more accountable.
Right.
And I'm thinking if you do this presentation to them, because we on the bottom, we don't make no decision.
That's a good point.
You know, you need to go to the decision makers, to be, because this is good. I promise you, this is good. It is, and it's you know, I'm finding this in like Alameda County and LA County, San Diego. Oh, they on the ball. That's who we follow. That's who smaller counties follow. But we need, like you're telling us, you need to tell our directors, like at Stanislaus, San Joaquin, because they're doing things, they're improving. But if you could see it, you would do it. This should be a model.
But you still need to engage the board, though. I still want to be a part of it, and I still want to.
And I'm thinking,
Absolutely.
right.
But
And
I think we should.
we should be a part, but I think it should be in leadership.
I'm a
What
little
decisions
confused as
to
to
make.
if our county did not or does not complete one of these, for example, if our, director and her staff don't do it, then you want the boards to do it? Or are we supposed to do it? Are we supposed to duplicate it? Let's say our county submitted it, but you'd like it from the mental, the behavioral health advisory board. You don't want that?
We're looking for one.
Okay, so if our county submitted it,
yeah,
you're not asking for it.
Right. For the larger counties like Orange, LA, San Diego, as she mentioned, they're very sophisticated and the board can deal with it. But for all the medium and small counties, they will need to partner with their mental health staff. And so, as Susan mentioned, it's a collaboration for you guys to work on this together.
Yeah, well, first of all, thank you for doing this, and I think everything in here is relevant. But the message that I'm hearing around the room from other small counties is that maybe there should be more questions on this particular issue, this interface that's being raised, which is the acute problem, the acute, as I said earlier, the severe and acute and sometimes chronic mental health problems that are going on, which really don't get dealt with because there's a lack of professionals that can intervene. And as you said, you have 3 therapists, but how many of them can write prescriptions? Well, psychoses are dealt with medication. Psychoses require medication, not counseling. They require treatment, and they require treatment by someone who's licensed to do that. So the whole medical part of our mental health is sort of being, it's a very important part of it, and I think a lot of the resources have been diluted away to
deal with many of these other issues, which are important,
Right.
but they're primarily social, not medical. So there's a difference between someone that doesn't have a place to live and drinks too much, and I know they need care, but the dollars to deal with acute psychoses, to take care of people that need to see a psychiatrist, to go to a facility, that money has to be brought back, because when it gets diluted in all these other social services, there's nothing left, and that's what we have in these rural counties. We have nada, as in my county, and I'm familiar with Nevada and Placer and Humboldt and Mendocino, all of these rural counties, up and down. So California, as you know, we have California. You know what? We have 38 million people. Like 25 live south of the Tehachapi. There's only a couple of million people that live north of Sacramento. Maybe 2.5 million. 1.6.
1.6.
Well, that
far
doesn't
north.
include the coast.
Yeah.
Okay, so what we really have is, we have a coastal group, and we have Central Valley, but we have these small counties, and our problems are, maybe they're not any more severe than they are in the cities, because cities have lots of problems, but we don't have the resources in these small counties to deal with these problems, and it's particularly worse in my perception is that a lot of this money is going elsewhere to take care of things that really don't have anything to do with severe mental health. And in fact, the fact that they changed the title from mental health to behavioral health tells you what's going on. And I think it's problematic, because now that we have behavioral health, we're not really dealing with these mental health problems. Anyhow, I've said enough. I think I made it really clear about where I stand, and I've come here and I see that everybody else here has the same kind of view, which is we don't have the resources. And the message that needs to be coming back to you is that because if this gets a short shrift, if there isn't enough attention, or it's getting filled out by someone who's in charge of MHSA money in their county, the overwhelming majority of which is going to those other uses, you're not going to get that information back, and you're not in a position to ask anyone to act on it. Is that clear about what I just said?
Well, you all are aware of this now. Make sure you ask to see it. This should not be sent to us without you guys knowing about it and having had input on it.
So that's really, really important.
So I don't want to take up more time. Are there any other questions? At the end, you will see there's contact information for Linda Dickerson, or at the data notebook at lmhbc.ca.gov. There's a phone number on the back. So if you have any questions, we're here to help you. So you can telephone us or email us, and we will get back to you.
Did you bring cards, Carla?
Yeah, I have some cards. I'm not sure I have enough, but you can reach me at these as well. Yeah.
I think that the real challenge with these reports and results is to get our Board of Supervisors to care. Because our Board of Supervisors in our county drives whatever the department is. And so as the elected officials, somehow their brain has to be turned and focused and spotlighted, and not just a pat on the back, oh, we're glad you're trying to do good work, which is typically what happens. We're glad you're volunteering. We know you're working hard. We're glad you're doing good work. And that's the summation of their response to the mental health board when they do a report. So somehow we either have to get heavier boots on, we have to make a much more cohesive presentation when we talk to the Board of Supervisors, but there's a gray area that exists that ends up saying, oh, good, you're saving us money, department head. You're saving us money. Thank goodness you're saving us money. Even to the point that our mental health board gets a little budget to use for going to meetings and travel. And historically, our chair's been proud of the fact that we give back a third of that money to the department rather than spend it on training.
Oh, yeah, no, that's not good. No, that's not good.
Well, and I think that's just been a historical thing because,
They get strokes from the board. I understand that. Yeah.
Well, thank you for your time.
Thank you.
And I look forward to getting your responses.
Built collaboratively.
Okay. Moving on here. several people asked about, so I thought I would just talk a little bit about how does your board recruit and orient new members. And then we'll move on to community advocacy and outreach. So that's still in the first section. It's at the very sort of end of the first section. So I don't know if you have specific questions I could answer, or if you want me just to go quickly over it and then we'll answer questions. Quickly over it first? Okay. The membership of your board is appointed by the Board of Supervisors. We all know that. So when you make a motion, you know, you've interviewed people maybe, I heard you talk about that. When you make a motion to appoint for a specific person to be appointed to your board, your motion is actually that you recommend that the Board of Supervisors appoint that person to your board. You cannot appoint people to your board. We're all clear on that. Each member of the board is actually appointed for 3 years, and the appointments are staggered. If you, of course, have someone filling in an uncompleted term, that term would be different. Appointees should be individuals with experience and knowledge of the mental health system that reflect the ethnic diversity of the client populations in your county. We talked about that a little bit earlier. But you can also design your membership to include other sort of folks. You know, you can have what I would call focused appointees. You know, you can say we would like, I mean, you get a Board of Supervisors representative. You get that. That's a freebie, so to speak. But you might want someone that represents the jail or the sheriff's office when the sheriff's office runs the jail to sit on your board. And we have found that to be just an outstanding connection. Outstanding, because for one thing, it really educates that person about the mental health issues in your county. So what you need to do is, as you look at these appointees to your board, you need to think about what do we really want? What do we really need? You know, we touched on that conversation earlier, but I just want to come back and reinforce it. So it's rare, actually, that the Board of Supervisors arbitrarily and capriciously picks this person out of nowhere and puts them on your board. I mean, that's rare. Usually they say to you, hey, help me out here. You know, who do you want on your board? I talked with several of you during the break, and one of the points of discussion was, and I think all boards have problems finding clients and family members to fill that 50% that you have to fill, at least 20% clients, at least 20% families to form at least 50% of your board. And this has actually become a bigger problem because many of the very capable consumers that we have who sit on our board then are offered jobs by the Health and Human Services Agency as peer counselors. And can they stay on your board when they're offered a job? No. You know, so this can be quite a problem for you. And, you know, I don't want someone not to get a job because they sit on the mental health board. At the same time, that's a high turnover place. So I think that it's really important that new board members are oriented, I guess is the word that I'm really looking for. I think that it's really important that new board members get a mentor of some kind. Doesn't have to be the chairperson, but I've seen many boards that use a kind of a mentorship process, and that is a good way to do it. You know, just call up before the board meeting and make sure they have a way to get there. You need a ride? You know, I remember one time we had a consumer who, in Reading, the buses stop at 7 o'clock. The meeting starts at 6:30. Well, you know, they get to the meeting, but then how do they get home? You know, and she wanted to make sure she had a ride home before she got there, you know, and so I would say, yeah, I can take you home. You know, that's not a problem. But that just allayed some more of the fear. Another piece is, are there things on the agenda that you don't understand? Let's just spend 5 minutes and pop right through so I can give you an idea of what each of those things means. Because we all know how scary it is. I mean, I'm not just talking about consumers here. I'm talking about me. You know, you go to a meeting for the first time and you're just going, whoa, what do they expect? What is expected of me? How do I participate? This is an important position. How does it all fit in? So I think that we don't pay enough attention to our new board members. And we all know that we have lots and lots and lots of new board members. So one thing that you can do is have, and some of us talked about this during the break as well, have mini trainings at the beginning of the board meeting. So you could have a mini training, a 5-minute training or a 10-minute training on how to make a motion. You could have a 5 or 10-minute training on requirements of the Brown Act and public comment. You could have a 5 or 10-minute training on, or 20 minutes on marijuana in Stanislaus County. You could have any number of things. But what you have to do is try and build that around the needs of your members. The other thing that we have to remember is just because someone is an attorney and you got them on the board because their wife maybe has a severe mental illness, that does not mean just because that person has initials behind their name that they are all knowing about mental health. So instead of mental health, and every mental health board is different, but it needs to go to the knowledge of the board. And I think as Jane was talking about our data notebook, this is the kind of project that I really want the mental health board to do in collaboration with the director and the director's staff. I don't want them bring it to you and say, here, we're all done. Take it away. Because we're not looking for the director's opinion. We're looking for the director's help, but not necessarily the director's opinion of what the services are. So this is a two-way education thing. Not only are you educating the California Mental Health Planning Council, but you're educating the board as well. So look for every single opportunity that you have to do that kind of thing. One of the problems with getting people with experience, and people with experience and knowledge of the mental health system is super great, but a lot of times they come with their own agenda, don't they? So keep that firmly in mind. So how many of you interview potential members? You all do, right? So almost everybody.
We have them.
Yeah. You have them.
Yeah, I think we asked them if they can breathe. And
Yeah.
Yeah.
They want to be on the board
Yeah.
and do you breathe. Yeah.
Unfortunately. Anybody we can get, we take them.
Yeah, see, and that is kind of difficult. I've been working with, nobody's here from Plumas County, right? Plumas? So I've been working with the folks in Plumas County, and they're just struggling. I mean, they have like 2 or 3 members on their 15-member board now. And I said, well, the first thing you need to do is reduce the size. I mean, Plumas County has 20,000 people in it.
Yes.
And they're scattered all over. So because they're small enough, they can have a board that looks different than the 15-person board, because they're a small enough county. So, we talked about that. They also they've changed, I think, mental health directors several times in Plumas County. So they don't even have that solid piece,
Correct.
So you have to look at your own culture of your board and figure out, how do I support those board members? Because if nobody talks to you when you walk in, nobody supports you, and you don't know what's going on, how long are you going to stay? Not too long. Yeah. Not too long. And you can easily lose some very good people that way. Comments? I see you there sitting back in your chair. No, I was talking. Go ahead. I was picking on you.
On me?
No. You have a question?
Yes. One of the difficulties that I've had with with the board members, I realize, when they come on board, there's a learning curve. And so I don't try to call them to make a point or anything like that. But after settling in, so to speak, 6 months, a year maybe, then, I kind of expect them to find their voice and say, but there's 2 or 3 board members that I have yet to, they rarely, if ever, even one board member, I never heard him utter a word at board meetings. And I've tried to take attention without being critical or anything, but trying to be helpful in some way of them finding their voice, the term that I use. It's too bad that we have 3 or 4 board members that just do not contribute anything, and even getting them to serve on committees, that's something I've been working on. We're dealing with that, but I'm just saying, getting consumers to be active
and so maybe that's a place where a mentor can help out. And I have to say, I've never used mentors personally on the mental health board, but I used to work with people with developmental disabilities. I used to work in the regional center system. And in the regional center system, we're also required to have people sit on the board. And if you know anything about the regional centers, you know that those are folks with mental retardation, epilepsy, autism, cerebral palsy, or a neurological handicap that requires treatment similar to that required by a mentally retarded person. So by far, the bulk of the folks that are served by the regional center actually have lower cognitive skills. And so when we were required to have them on the board, the director handed me the issue, and she said, so how on earth are we going to do this? Because we make some major decisions, and how are we going to make sure people understand what's going on? And so we actually had board training. I mean, we did, before you could even, well, this sounds very judgmental and awful, but before you even applied to be on the board, you completed some board training. So one of the things that we need to help our consumers with, I think, is what other board possibilities are there? More and more there are opportunities for stakeholders to hold a position in the community.
Yeah, I want to share a little bit about what my own experience. When I first started as a board member for the first, I'll say 2 years, 3 years, I never said a word. Just like you. I sat there, I had no clue what they were talking about. It was like, But I have to say that we had a retreat, the board, and it really, at that time, that's when we formed committees. And everybody in that board must pick at least one. And I just said, I'll do that, because I was forced to. And then once I was on that committee, then, there was other people that will be part of that committee. So we kind of split our duties. And it really gave me a sense of what I was supposed to be, what I was supposed to do, and I learned more. And right now, we are really on the way to create, we already have created, I'm on the board to do recruiting. So we have worked together, we have a PowerPoint of what we do and all that, and then we are now going out to recruit. We go to all the organizations that we think will be where we can find people to be interested, because a lot of organizations don't have a clue. What's the mental health board? Who are you? So we want to educate the community. And then also, I jumped on and decided I could be a mentor, because I am not on my 70s. I know a little bit more than when I first started. So I'm the mentor to
your mentee over there.
Yeah, so he just joined, and I think that is each one of us should be doing.
So, do you have like a PowerPoint or something that you?
Yeah, we worked on it for months. We got all the information, what the role, and that's exactly right here. How the roles and what the responsibility. It goes to detail, and that's what we use. And we even have it on like a little folder, and we'll take with us and we'll give it to wherever we go to do a presentation. We make an appointment, and then we know how many people will be there. We know how many openings we have, and what the openings are in what district, because we have, in South County, we have 5 districts. And you can only come, and become a board member if you are if you live in that district. If you live in another district, you can't. So that's why we make sure we know, so we can share that with, wherever we go. So when people say, yeah, I'm interested, and then, oh, but you can't because you're not in our district that we need. So, there's a lot of work, but if you're really committed and you want to put your time and work on the details, you can recruit. And once you have a new member, you have to really help that member.
Yeah, I like the fact that you are advocating. We kind of just sit back and the job opening is announced in the newspaper, and I guess we just sort of wait for people to notice it. But, I thought, what you guys are doing is way better because it would seem like you would have better people that are genuinely want to do something in the community as opposed to somebody that is retired and they just want to fill up the time slot or something.
And they do not only just become a board member, they must also serve on the committee, and then on top of that we have all the ad hoc committee, and we ask, would you help, and so they're really involved. And I think once you're involved, you spend time, you kind of feel like you belong. So that's what we did.
I think this idea of the ad hoc committee, what we've found has been valuable because 2 or 3 people, you have lunch, you actually start to make relationships with other people on the board rather than coming just once a month, which is really, has fueled, I think, the change on our board in the last 6 months. But it's also a case, we're always full because we've been so controversial.
Remind us what county?
Mendocino. No, we are always running, like if one person's, leaving for some reason, there's somebody else that just slips right into that slot that we've already, because we've had so much controversy and the paper's always talking about issues in mental health, we have people coming out of the woodwork now to be involved in our board. Because
you get coverage by the press, though.
Yeah, because, not so much but because of our department has had some issues that have been gone through the Mendocino has contracted out all of its mental health services to private providers.
And many small counties do contract.
El Dorado does a lot.
But what it has happened is that has created a lot of controversy on who got the contract, and so we're constantly, there's always newspaper reporters at our meetings, and when you were talking about taping, I was at home one day and I had a friend call me and said, oh, here, I heard you talking at the mental health board meeting. And I was like, what? It was on the radio station this morning when you said about such and such issue. I was oblivious that somebody had been there recording it, okay? So, and that's why I'm saying that but because of the controversy, we've almost been able to take advantage of that.
Okay, as long as the person is a reporter and they haven't.
No. Well, I don't.
Seriously, let's go back to your comment quickly, though. As long as the person isn't a reporter, well, I think that would be difficult for them. Let me put it that way.
We didn't have a newspaper within, 20 miles of us. And the closest one, there's one at Lake Tahoe, but closest one's in another state.
It probably wouldn't work. But that's been an advantage for us, for our department. We can get them to kind of misbehave, and so people wanted to get.
Which, it's not necessarily the reason that you want.
No, but it did mean that people knew we were around.
Would you be willing to share your presentation with some of us?
I asked her if she would send it to me, and I will send it to Shoshana, and she will have Kelly send it to at least the group here.
Okay. You were talking about addressing. I mentioned the fact that our the Stockton Record, which is the main newspaper there, they won't put any of our meeting dates and times in the paper. Is there some way of?
Okay, so let's move on to community outreach and effective advocacy. We're getting to the end of questions. Go ahead. Yeah.
We have one seat available, and it should be for a Latino. And none of us knows anyone right now, and so we're wondering, do we keep this seat open, or do we have to do more to get that
I think sometimes it's worth keeping the seat open. This is Susan speaking. This isn't any, great guru. But honestly, in California, we are fools if we don't acknowledge that diverse, that population, which is actually the majority population in schools and about to be the majority population in the state. We have got to make sure that voice is heard. So if it were me and I was the chair, I would say we need to develop a plan for outreach to get that person that we need on this board. And we're going to talk about that kind of thing just the way it's fit.
And we're talking about attracting new members. PowerPoints and mentoring is good, but it's 15 people on a board. When somebody come on the board, I've been on the board almost a year, and I'm learning as I go. And I had a mentor, but I wasn't mentored, and it's good she's mentoring, but anybody can make a PowerPoint. You already going out in the community. You have to do in-house before you could do outside house. I mean, our profession should, any one of us could put out a PowerPoint and explain that, how to engage with other people. When you come on a board, you wanna learn how to be a board member, and you just skated over that.
Well, I'm sorry, we did put it in at a board meeting before we even went out. We shared that with.
I never seen that presentation.
No, it wasn't a presentation. It was in a packet at the board meeting. We brought it in and shared.
I'm on an ad hoc committee.
Maybe we have to make sure that you.
So let's let you two settle that outside of here. I'm modeling for you. That's a discussion that can take place somewhere else. But it's really important, and the points that you bring up are really important too. And we're going to hit on a lot of those. I'm hoping.
Because you don't have to be on the board 7 years to know the structure. I mean, sometimes that's the environment and not a structure.
Sure. Environment, culture, whatever you want to call it. So, definition of advocacy. So when you talk about advocacy and community outreach, you're actually in some. Huh? Oh, yes, that's the packet on the other side.
Oh.
So we have now moved from whatever was the right side to whatever's on the left side. And sometimes when I have time, which we don't have today, we actually do an exercise and try and get something done. But today we're going to mostly just talk about advocacy and community outreach. So advocacy and community outreach are really two different animals, okay? But they intertwine quite nicely. So I want to talk about what is advocacy first. And advocacy is a political process by an individual or a group that aims to influence public policy and resource allocation decisions, resource allocation being the money, within political, economic, and social systems and institutions. So advocacy is really important, and advocacy is, I think, not something that happens by accident. Advocacy, I don't have in here that it's a purposeful political process, but it really is purposeful if it's going to be effective. You never get somewhere unless you know where you're going, and advocacy is a pure example of that. So community outreach is one way that you explore your advocacy. We're going to talk in 4 specific areas. We're going to talk about media campaigns, and I actually dare to say that none of us have the money for a media campaign. So we're not going to talk long about that, but we are going to talk about it because despite the fact that we have no money, we can still use the media. Okay?
CalMesa, if your boards are affiliated with CalMesa, I think there is an effort to do this outreach like that, the public service announcements. fortunate enough.
Right. So, when we talk about media campaigns, what would be media to you? I mean, what media do you actually have in your county? Most of you have a newspaper, but not all of you. Radio. Television. Internet. Facebook. Pardon me? Fair. Yeah. Events. You know, I know that lots of people had a mental illness awareness event for May, you know. I mean, those are good things. Radio, I think, is excellent. So we hear that we can't get the newspaper really to pay any attention to us. We can't get the newspaper to even broadcast our meetings. But almost every newspaper has some kind of date column. So if you pay attention, then you can get yourself into the date column without them even paying any attention or knowing. So you need to explore that date, that calendar. Almost every paper today has calendars. And you have to be like 6 weeks ahead. So, but you can do it. You
have to pay for that?
No, it's free. It's free.
All of the, now they advertise, maybe 6, 8, or 10 other boards, but.
Yes. So I would venture to say it's because those boards are doing it right. Somehow those boards have figured out how to do it right. You know, because calling up and saying, would you put my board in the newspaper, is not going to get you anywhere. You have to figure out where in the newspaper it is. Look for that date, that calendar thing. Sometimes it comes out at the beginning of the month. Sometimes it comes out every week in the Tuesday issue. You need to explore where are those dates, when do they come out, and then you call the person that's in charge of that, and you give them the information for your regular meetings, which always meet on the second Thursday at this place at this time, right? So look, part of it resides with us. Look and see what you can find out about that date.
But they have Facebook, and you just go on their Facebook and put in information.
But remember,
they have Twitter too.
Yeah,
and
there
Twitter
is Facebook and there is Twitter. But I have to tell you, I'm even the communications chair for the League of Women Voters of the United States, and I do not have a Facebook account. I have to tell you that I am not putting myself out on Facebook. That happens to be me. I don't want to be out there. And to be honest, I don't want to know what Gracious did and Joan did and John did and you can die with Facebook up in your face. You know. So I'm not saying don't have a Facebook page so that people can come and see things. Yeah.
What I'm saying is news stations have Facebook.
Yes, they do.
And they follow Twitter. They
right. And you can just put it on. Right.
Yeah, the board can have a Facebook.
The board can have a Facebook page. Right.
I think Steve, I'm wondering though, like in our community, it's the department in our county that puts it in the paper. The mental health department puts these announcements in the paper.
We've tried a different angle, different approaches, both behavioral health services, the mental health board. We have a reporter that occasionally will come if we have a controversial topic or something. They send one of these.
So they know you're meeting, but you're just trying to get the announcement in the paper that you're having a meeting, right? So maybe your board of supervisors clerk has to do it for you. I mean, I would think.
The board of we have a new board of supervisors, and I'm. Thank you.
You're on. I mean, you have to figure out also where you want it, because asking the person who comes to your meeting as a reporter is not the way to get. Is not the right way. So you know, one of the things that you have to think about media and about any kind of outreach is, and we're going to talk about this in a minute. You know, what do I want? Then you can figure out how to get there, okay? But I want to go back to newspapers just for a minute. So one of the things that we do at the we have a very small newspaper, pretty small newspaper, and they almost never write articles about us. But if we write an article and take 3 pictures of the Mental Illness Awareness Week activities, it's in that paper because they don't have the staff to do it. So they can't send somebody out to do it. But if we send them stuff, especially with nice color pictures, it always gets printed. So, you know, what you need to do, and I think I talk about this a little bit later, but I'm going to talk about it now because we're going to run out of time if I don't watch out, is what I usually do is when I was the chair of the Mental Health Board and when I'm the chair of some other committees, I call up the newspaper and I say, I'd like to meet with your editorial board. Anybody ever done that?
Yeah.
So you call up, I'd like to meet with your editorial board. Well, why? Well, I'm the new chair of the Mental Health Board locally, and we have some issues that I want to talk to you about. That's one place when you finish this, you can take it and say, hey, look what we just found out about our county. Don't you want to know about this? Don't you want to put this in your newspaper?
Absolutely.
Right? Do you see what I'm saying? You have to go with a purpose. You have to go with intent. You have to know what you're going to talk about. You have to all be on the same page with the same template of discussion, right? The 2 or 3 people from the board, they'll put 2 or 3 editors, probably whoever the reporter is that would cover that will be there. And you can say, you know, this, we want good press. You want press? Well, there is that problem, but then just send one. So think about that. You know, think about how can I sneak my way into the newspaper and the editor. Okay.
I just think that didn't. It just did
That's
not
why we're
occur
here.
to me, and you guys are helpful. Wow, thank you.
Great. So I really think that's a good thing to do. Touch base with them. Another event around which you could touch base is say, I don't know if you know or not, but we're going to the Board of Supervisors next week or in a month with our annual report. And we'd really like you to have a preview of that report, you know, so that you'll know what's coming up. Do you see where I'm going with this? Or maybe you know, go through in your mind, you know, maybe a new program's opening. You know, Northern Valley Catholic Social Services is going to open the Mark Olberg Center, which is a, you know, wellness center. We'd like for you to know about that, you know, and find a person with whom you can make a relationship. You know, so I have this guy, Joe Sidlowski is his name. I'd like to say that because I finally learned how to say it. It took me forever. It's got C's and V's and all kinds of things. Joe Sidlowski. And I have to say, Joe even calls me up now. It used to be I would call Joe and say, hey, Joe, you know, we got a little something happening. Thought you'd like to know. Just giving you a heads up, you know, and a few tempting things. One thing I will say about working with reporters, how many of you work with reporters?
Or half.
Yeah. So working with reporters can be dangerous, I'll be honest, because there's no such thing as off the record. You know, so if you want to talk with a reporter, you have to be sure what you want to say. Very sure. You know, and so there's a couple different ways that talking with a reporter happens. You might purposefully go to a reporter. If you purposefully go to a reporter, you've probably written down what you want them to know. If you're going to go to a reporter, don't have them depend on what comes out of your mouth. You know, give them very little out of your mouth, or read the piece of paper that you wrote and you're going to hand to them so that you make your point. You know, because it's easy. Think about those reporters. They write stuff all day. They don't remember you from yesterday, or they won't remember you tomorrow. So think, what are the 2 or 3 things that I want this reporter to take away from this meeting? Write them down. Say them an average of 6 times each. You laugh. An average of 6 times each. And then be done. So if a reporter calls you up, what do? Hi, this is Joe from the Record Searchlight. I want to know what the hell you all did last night at the Mental Health Board meeting. And you might go, oh, well, you know, it was really not that important, blah, 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 blah. It's sort of like making a motion. Don't just blither. Just say, hey, Joe, you caught me at a bad time. Can I call you back in 15 minutes? Give me a number where I can reach you in 15 minutes. And tell me, could you give me a couple questions just so that I can mentally prepare myself. You write down the questions they want. You write down the answers you're going to give. You give those answers no matter what question they ask, because that's what you want them to hear. I mean, so they ask you, you know, why is the color purple important to people in mental, or lime green important to people in the mental health world? You go, well, really, you know, you can apply that to the Mark Holberg Center that's opening tomorrow. You know, there'll be some lime green there. Do you see where I'm going with this? You know what you want to say. You make it fit. Okay?
But when they call you, they want to know, what they want to know is what they want to know. And if you don't have that information, they're not going to call you back. You're not going to get in the
No, but what you're going to say is, I'll get back to you in 15 minutes, give me a number, and you call them back in 15 minutes.
But
You don't forget to call them back?
That might be the 15 minutes they took out to call you. And if you tell them you're going to call them back in 15 minutes, I don't think they're going to call you.
If they bother to call you, they'll be waiting for your call in 15 minutes. I can literally guarantee you. You know, I mean, I've done so much work with newspapers and TV. I've never had a problem. If it's late in the day, you might say, do you have a deadline on this? And if they say, I have a deadline in 10 minutes, then you know that they're not going to write a decent article anyway. And you pass it by. Because you don't want bad press.
They wanted to do a documentary, a five-minute piece on me, and I was going to Holy Names. I was in class. I couldn't talk to him right then. He went to the next person.
Right. That happens. I'm not saying that doesn't happen, but I am saying that
And the pieces
that my
I have
method is a fairly...
It took time. Yeah. And then they didn't print it when they said it was going to print it. But I was so grateful. And I was on their terms, not they on my terms.
But I think the critical thing is that you don't want to be caught off guard.
That's right.
And typically most of us can't respond on the spot with three precise
messages
and not have it misinterpreted and printed incorrectly. And I think I would rather wait or not be printed than to be printed incorrectly.
And sometimes you'll make comments and they don't print them at all anyway. You know, and you go, damn, I spent all that time doing that. But then the one time they do it and 27 people call you up and go, whoa, you're on message. That was great. You know, it makes it all worth it. So you just have to, they're just people. They're just people. Yes.
When I was running an advocacy group, I had this rule in-house that, because we were a very small staff, 3 people, this one site, that we sent out a press release on Tuesday afternoon. We went through volunteers and came up with every radio station, newspaper, magazine, TV station, whatever in this 3-county area. What were their fax numbers? What were their email numbers? And so we had this pretty significant list and tried to do it through email if possible or fax. And then that was a roll that something had to go out about it every Tuesday that we would send out, because my rule of thumb was that we wanted somebody to read about us or hear about us someplace every 2 to 3 weeks. And so maybe that's all it got, was every 2 or 3 weeks. But then you figured that meant you were at least maybe being heard by the public 24 times a year. So, and then that was just, but it meant we had to spend upfront time compiling all this, names, people, and all that stuff. But then it was just like clockwork, and it was very effective.
I mean, and I have at work. I actually do it all by email because I've discovered people don't manage to check the fax machine.
No.
Or they put it on some desk or whatever.
This was 10 years ago.
Right.
So back then more people were using fax.
But today I have an email list that has, you know, every station, every whatever, and I don't use it as regularly as you do, but whenever there's anything interesting, I use it. Yes.
I was just going to say that you have to actually be careful, because anything you say as a representative of the board probably should be cleared through the behavioral health director, because, you know, anything that could be even remotely construed as a negative or something, you know. So I mean, it seems like you have to coordinate with the director.
Now, these weren't opinions, these were, this event's going to happen, or so-and-so is doing a meeting on this, or we're having a topic like this at our next board meeting, the public's welcome.
Right, and most counties actually have a person that's in charge of doing those kinds of things, so you wouldn't even have to do that legwork.
Yeah.
What you'd have to do is your ad hoc committee or your board or whoever was working on something would have to say, gee, we should get this in the newspaper. How are we going to do that? And when I went for the editorial board meeting, I mean, you don't have to take the director of behavioral health, but if that person was willing to go, I mean, it really puts some extra strength in your meeting, you know, or if they send a representative. So, you know, I mean, some of this information is sort of generally wide, but, you know, I'll go back to my first comment, and that is every one of your counties is different. Every county has its own culture. Every board has its own culture, and you have to take the information that I'm giving you not as the rule, but as something that I can fit or not fit into what I do, you know.
The one thing that I've been thinking of is, you know, MHSA was portrayed in a very negative light last year,
Little Hoover
few
Commission
months
report.
ago. And indeed, probably rightfully so for these, some of the expenditures that were put onto MHSA money. But I would like to see more positive things being put that are being done with MHSA money, because you know, that really put a black eye on the on MHSA funding, and I think all of our counties need to think about showing the good work that we actually do with this money, and some of the programs that we've implemented, and prevention and early intervention. And
okay, so if you put that information together, to me, that's a perfect editorial board intro. You know, we have just put all this information together locally, you know, to inform our public about how we are not like what the Little Hoover Commission report says we're like. And let us give this to you, because, you know, a reporter can take that, and they've seen articles already from the Little Hoover Commission report, and they have formed an opinion. And if you give them something different, you know, let me give you an example of one thing that happened to me. So in Shasta County, I was on the board of this substance use treatment disorder clinic. Actually, I was the chair of the board. And one Sunday morning, the director died. And I was the only other person who could sign checks. So I took it over for a while. Actually, I'm still there. But I took it over. And, you know, this place had the world's most awful reputation, because clients hung out and smoked, they sold drugs in the parking lot, you know, and in an empty field beside the parking lot. I mean, you know, you all can imagine, you don't need help here. And so I decided, well, I need to change this, you know. And so I started doing some research, and I found that heroin had come back to Shasta County. For years, we hadn't had heroin in the county. We had OxyContin mostly. Yeah. Yeah. And so now all of a sudden we have heroin. So I had my staff count up, and we discovered that 48% of the clients that came into our program came in because of heroin. Now, how interesting is that? No methadone clinic. You know, nearest methadone clinic almost 100 miles away. Now, that is interesting to the newspaper. So I could dangle that in front of them. I could say, you know, 48% of my clients come in because of heroin, and we have no methadone clinic. You know, all we have is a little Suboxone, or, you know, this, that, or the other thing. You know, we need to do something about this. And I mean, they were on it. We got above the fold on the front page. There was a video online with two of the clients. Each of them, you know, got to make a video that was shown. I mean, you know, you have to figure out you have to figure out what they want. And then you have to figure out how to get it to them. Does this, you know, and it's not easy, and you can't go home and do it tomorrow. You have to let this sort of go. I mean, I had run the clinic for a year before I managed to get that story in the paper. You know, and I started the first day.
So what was the end result?
The end result was we certainly had more clients.
You need have more clients because of addiction. And it's probably a lot of other clients you didn't even know about. But
Well, another,
but what was the benefit? Did you get the methadone clinic?
No, I didn't. I haven't gotten a methadone clinic yet. But
What was the benefit?
well, the benefit is just to get the information out to the public. I mean, I wasn't after. I have to tell you honestly, I wasn't after more than getting information out to the public. Because when I would say to my friends, you know, heroin's back, they go, oh, Susan, just because you're taking over this clinic, you think everything's bad. And I go, no, you know.
Let me just pick up what she's saying.
Okay.
Maybe it's better not to focus on the public, but to focus on the decision makers in the community.
Yeah, on the public policy.
Yeah,
makers.
well, to convince the people, the supervisors, the other elected officials, your assembly person, your senator, your mayors of communities, et cetera. Maybe her point is well taken, which is if you can't, what good does it do to get?
The importance is the awareness of the public, because without the public support, the board of supervisors won't be inclined to approve more money being spent for a methadone clinic, right? They're going to say, well, you know, the public doesn't care. Well, no, these are public officials that are voted, and if we're voting in people for the board of supervisors, and the public thinks that they're wasting money on methadone clinics.
That's what the little Hoover report was about, accountability. That's what I was there in Sacramento. Do you know it's counties from across California, they couldn't give the commission accountability.
Right.
And now everybody is mad at Hoover for making the decision they made.
But the public needs to be involved. The public needs to be aware that there is a problem. And once you get the public involved and they'll say, you know what, I need to vote yes for funds being directed towards.
And the time frame. I mean, there is a time frame.
You're right.
Sure. You know, advocacy is not something. Prop 63 took a really long time to get to where it is. I mean, it took a long time to gel in Steinberg's mind. Took a long time to collect those signatures. Took a long time to get it passed. Took a long time to write the regulations. I mean, when you're talking advocacy, you're not talking about changing today or tomorrow, for the most part.
Advocacy is not linear. It doesn't go A.
That's right.
to B,
That's an excellent
C.
point. Excellent point. Advocacy is not linear. It doesn't go A, B, C, D, E, F, G. It goes A, Q, R, T, you know, and sometimes it goes to 2s and 3s. I mean, I'm serious here. You know, and sometimes does advocacy have bad repercussions? Could be. Because sometimes we advocate for something that looks so right, and it turns out to be wrong. You know, so one of the things, if we were doing the exercise today, which we're not going to do, one of the things I would say to you is, okay, what could go wrong here? You know, how might the perception be different than what you anticipated? Because, and it goes with this advocacy is linear. You know, we tend to think, if we do this, then this happens. If we do that, then that happens. And we forget sometimes you do this, and this happens. Way off base. You know, so that's why I'm saying you have to message yourself, and you have to be really careful, and you have to think, what are the results of this messaging? You were going to say?
I was going to say there's always unintended consequences for outcomes. And, you know, I do think, though, that's why it's important that you have people get together before you just pop off with something. Because you all have to explore, well, what could be the outcomes on this? So when you sign on the dotted line together, you all have explored what could be other types of consequences and outcomes. And I think that's what's so important about building these cohesive boards, where you have this open kind of conversation and dialogue.
Speaking with one voice.
Yeah. So in the end, you're not going to have somebody say, they never discussed that with us, you know. Yeah.
Because like the people that's not being served, they should be more in these rooms, like they do in Alameda County.
Oh, yeah, Alameda County does it.
Up here.
Just looking at the local service.
And their crime examples that it works.
We have a section in our newspaper for clubs and telling what times we're meeting and so forth. That's an avenue too. But I was thinking before about what I said about recruiting a Latino, and it just occurred to me, look for a Latino club.
I went to the Hispanic Coalition. We have a Hispanic Coalition, and that's where I went. Yeah. So moving on, if you're going to make a presentation to a group, let's move sort of past the media a little bit here and talk about presentations to a group. So something like I'm presenting to you all because I think you want to know about effective board. So, you know, that kind of presentation, or to the Latino club, or to the Mark Wahlberg Center, or wherever, the Kiwanis, you know, wherever you're going. I think the first thing that you have to really think about is who is your audience. You know, people say to me all the time, they say, well, why don't you go to the Kiwanis, or why don't you go here, or why don't you go there? And mostly I say, because they never do anything anyway for me. I mean, as it happens, this Kiwanis never does anything. And they meet at 6:30 in the morning when I'm not very good at speaking. But so you have to figure out who is your audience. Where are you going to go to get whatever it is that you're going to get, or whatever it is that you want. I mean, so you might be going to the Rotary because they want to know a little bit more about heroin in your community because they read the newspaper. You know, you might do that. You might. Or you might go somewhere else because you're trying to get a couple $100 extra for your Mental Illness Awareness Week activities. You know, something for clients to do. Or you might be recruiting a board member. One of the things I would say is, well, and I've got a whole list here. I mean, obviously, you've got to think about the County Board of Supervisors. You must address them at least annually. But is that the only time you should address them? Not necessarily. You know, I mean, I go to the Board of Supervisors and I use my 3-minute public comment period fairly often to just touch on something, you know, that's pertinent to the subject. I mean, your local mental health board or commission, the California Mental Health Planning Council meeting, James. Local legislator, you know, that's an audience that you might be presenting to. Local service clubs of various different kinds. And, you know, one of the things I think I hear every time I talk to people who work in the mental health field is people just don't know. People just don't understand. And I have to tell you, this has a real personal message for me right now. So I come from a really big family. I have 5 sisters and a brother, so 7 kids born in 8 years. What a productive mother. Then she went to the vet. So my brother called me the other day, like right before I went off to the monastery, and said, I'm having trouble getting a hold of my daughter. You know, could you run over there? Well, I don't live any closer than him. And I said, no, I just can't, you know, I got other things going. Well, it turns out he got there, and she had tried to commit suicide. So she wasn't answering her phone. You know, I mean, you know, it's so this brings suicide really to my soul all of a sudden. You know, here we have a 22-year-old law school kid, bright, never had a thing go wrong in her life that we know, spoiled rotten by my brother, you know, and she tries to commit suicide. You know, that kind of story can really be effective, because what it says is it's not their problem, it's our problem. It's my problem. You know, and I sort of capriciously say everybody has one, but we all know, and we all have in our families people with mental illness, mental health disorders, other kinds of things. It's not that we have to expose that family member. That's not what I'm saying. But what I am saying is, you know, when you think about where you're going to go, think about what is the story and what is the catch. you know. One of the neat programs I've seen in California is this program called Brave Faces. And Brave Faces is a program where the mental health department took half a dozen clients, consumers, and did videos of them, took pictures of them, and taught them how to tell their story so that they can go to the Kiwanis and they can go to the paper and they can go to the American Association of University Women and share that up close and personal story. You know, so you have to think about who's your audience, you know, and how are you going to grab them. Arnie, did you have?
Well, what I want to know is who's you on that slide. I'm just a little confused because the focus here is where you're going to go with it, and we were talking about the effectiveness. So you is a local health board, isn't it?
Yeah. You is the mental health board in this
discussion. You need to knock number 2 out.
Yeah, we can knock out
so
number 2.
you really only have 3, okay?
Well, you might have others.
You got the supervisors, you got your legislators, and you have your local service clubs, okay? And you have others. But number 2 doesn't belong on there because that means you're going to yourself.
Right.
And I think the point is that there really aren't a lot of places to go unless you really want to change or influence something. So I wanted to reinforce the point that was made earlier, which is that you really need to focus on the people that are the decision makers about how do you get the money into the county, how does the money get spent. Yes, and it's great to bring up the consciousness in your county, in your community of the issues. But, you know, your local folks are not the decision makers. Those are the decision makers. And those are the ones that are going to allow you to, your board of supervisors more than anyone else.
Right.
And maybe a little bit of push from your local assembly person, right? Because those are the decision makers as far as if you can make an effort to get more resources or how you're going to allocate the resources. And it's good to raise the consciousness in the community that there's issues, but I don't really think that's where the emphasis is. I think if you really want to get things done in the community, you need to go there and not to the newspaper. You can run all the articles you want in the newspaper, but all those people that may or may not read the article, they don't really have very much influence. Those are the people that have the influence.
So I have the opposite opinion entirely. I think that you have to start with groundswell with the community will. And I think the community will have to build up enough that the supervisors suddenly turn their head and listen and not from a report.
But if you take enough people to the board of supervisors.
Exactly. I think you really have to go in the hills and build up your cadre of people that all kind of swell up and show up at the county board of supervisor meetings. And I've seen that when I've gone for there's a mental health issue and they politely listen to the report. And then something comes in over another issue and there's 100 people sitting in the audience because they did their job and they called everybody up and the board of supervisors really is listening and taking notes. And so I feel strongly about this starting with small ways, communicating with people, bringing them in, getting more and more people involved. I call it, you have to raise a lot of friends to raise money. And you have to raise a lot of friends. Grassroots approach. Yeah, I believe strongly in raising a lot of friends in order to get the money from the gatekeeper.
Your point is well taken. Thank you.
I mean, but it's our personal different experiences, I'm sure.
Right. One of the things to always keep in mind, we talked a little bit about the local board of supervisors, and we talked about local legislators. And I have to say, in far northern California, in these small population counties, one of the things that I've noticed is people go from the county board of supervisors to the legislature. There's hardly a legislator that hasn't been on the local county board of supervisors. So I think that, or goes back after they've finished their term and met their term limits. So I think that we have to think about the ebb and flow too of how things go. How does that ebb and flow? And so I think it's just an issue. And again, there is no right way. There is no right way. Your way is right, and your way is right. It depends on the issue, the time, the situation, all kinds of things. My plan is just to give you ideas. Then you take them away, and it's like a little toolkit, and you do whatever you want to do with them that works for you in your situation. So when you do your presentation, you have to think about what kind of approach are you going to take. And I have to tell you that most of the time I don't use a PowerPoint, but I prepared a PowerPoint for the trainers, so I thought I would use it myself as a trainer to try it out. I like what we're doing. I really, it's it's great for you to have the information. That's great. But I want you to look at me, and I want you to talk to me and talk to each other, you know. And I have to say, for a lot of groups, you put up a PowerPoint, and everybody sits there and goes, with their mouth open, staring at the PowerPoint, doesn't hear what you say, doesn't care because they're reading the PowerPoint, you know. And I have a friend who does a lot of PowerPoints, and she always just puts a picture there. And I said, I find the pictures distracting, you know, because I go, why don't you pick this picture to talk about audiences, you know? And so then I go wander way off base. Yes.
I find the best presentation is being real, speaking from your heart.
Mm-hmm.
And you know, even I do use presentations, but I don't look at that PowerPoint. I'll be speaking from the experience, and that's what touched the people, not what's on that PowerPoint.
Right,
And you have to be careful not to read the PowerPoint.
And you notice that I have the PowerPoint here in front of me, so that I mean, every once in a while I refer to this, but I never turn around and go, and then there's oral presentation at a meeting, and mail, email, postcard campaign. I never do that kind of thing, you know. So you have to do something that's comfortable for you, and for most of us, actually, it's talking. PowerPoint can be your talking notes.
I was just going to say there are many ways to learn. Some are more visual and some are more auditory. So both are different. Both can be very helpful.
And you just have to figure out what works best for you in that sort of thing. You know, personal meetings are a good way. We talked a little bit about editorial boards. A lot of people think when they meet with legislators, which is another good way to do it, you know, especially when you want to change public policy. A lot of people go, well, you know, my legislator's never in town. I have to tell you that's a problem in Shasta County. You know, our legislator isn't even from anywhere near there, and he never comes there because we only have, you know, like 40,000 voters or something, and we're just peanuts in his world. However, I meet regularly with his aides, and I have to tell you that information moves around. It moves around, so don't feel just because you didn't get the big muckety-muck that it matters. You know, go for the person that will take the hour to listen to you and will take notes while you're talking to them, and know that that note will go on. Okay? So be sure and think about that.
It's also
Do you think people just go to the Capitol every day talking to them legislators for nothing? You think they advocate over there every day for nothing? No, they are being hurt.
No, that's right.
It's also important to know what the legislators' focus is.
Exactly.
So if it's there in the budget committee, they want to know how it's going to affect the state budget and the federal budget.
Right.
And there are legislators who are very sure that they know the one and only right way to do something. And I would say to you, don't waste a lot of time on them, because it's harder to change people's minds than we think it is, you know. So when you're making a presentation to the group, you know, decide how you want to do it. Usually what I do, and that one of the reasons, for example, I handed out this Robert's Rules thing, and one of the reasons I hand out the PowerPoint is I really like handouts, because when I go home, I don't want to look at a PowerPoint. To be honest, I'm never going to, I might look at a little bit of a webinar, but the cat meows or the phone rings and it's toast, you know. So, I mean, think about what you want people to take away. And then I go again to my 2 or 3 major points. You know, don't inundate people. I teach parents the same thing. You know, parents, I say, how many rules do you have? And they go, oh, hundreds of rules in my household. And I said, well, can you name the top 5? No. You know, so I say the same thing to parents about working with their kids. Pick the 3 things you want to change, or the 3 things that are non-negotiable. You know, pick the things, just a few, so that you can go 1, 2, 3. You know, an elevator speech, a quick. You know what you want to say? Huh? 3's the magic number. You know, it's always been. So think about that. One of the other things is that I know a lot of people now in my old age who say, oh, I've made this presentation so many times, I'm not going to prepare. I have to tell you, I've made this presentation a million times, and I prepare every single solitary time. I go through all the notes. I check and make sure I update if I need to. I mean, I'm doing something on the Brown Act next week. I've updated some of my stuff, you know. So do that. The other thing is know the rules of the group that you're going to. So many times I go somewhere and sometimes they expect you to pay for your own lunch. Why weren't you here? We had lunch for you. You know, and you're going, oh. So make sure that you know what's expected of you. You know, what do you want from me? And what am I going to give you? Sometimes I go expecting to be able to make a half-hour presentation, and they decide to give you 5. So one of the other things you have to do is be totally flexible. I'm being totally flexible today. I took like 30 slides out already. One of the rules about PowerPoint is that if let's say your presentation is half an hour, you should not have more than 15 slides. So it's 1 slide per 2 minutes. Another unofficial but handy rule, you know, so that you're not flicking. I mean, how many of you have been to those where stuff flies in from the writing, comes up from the bottom and goes beep, 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 every once in a while? You like that? No. What were they thinking?
But if somebody's saying something that you want to hear that's really important, it's going to stay with you. Yeah. Because I have been to presentations like in Long Beach. That is still in my spirit. Because
that makes me so happy.
But I'm just using that for example because
Jackie was
you all
wonderful.
were there,
yeah.
And I know you know what I was talking about. And she wasn't really talking. The PowerPoint was in the back of her. She was sitting at the table, and she's not the only one, but she had something to say. Yeah. But it connected people's heart, and it was real. It was. Yeah. We hear politicians speak all the time, but we know when they're real.
Yeah. Yeah.
And she was making change.
Yeah. Well, she spoke with passion. She had the passion. You know, she was grand.
She was effective.
She was just grand.
Doing is effective. She's doing that today.
Yep. Yep.
Is that on YouTube or something? You guys have got me really hooked.
No, I don't think it was.
Okay.
But you know, you might be able if you YouTube Jackie Lucas, I'm sure that she's made that presentation to other people.
Okay.
At some point where it was done. So, or maybe she's done a TED Talk.
And it wasn't just her. It was the director of behavioral health care, too. When he was saying
Mark or whatever his name was.
Positive, too, and they was working together for change. That's how change starts. We could talk about it all we want around the table, but it should have been.
But that was a plan that took a long time to evolve, too. You know, and
it haven't got there. It's evolving. It's what Sally Zimmerman started. I mean, you know, it goes on and on.
Yep. Yep.
Is there a site where we could collaborate and share things like you mentioned, the video and other, you know, the PowerPoints that other people have done, where we could actually upload those and other people in the state could get them?
Well, you know, we could. I don't think CIVHS has anything right now like that, but we might be able to do something at the Mental Health Planning Council. Do you have that?
We've been putting all of our stuff from all of the trainings, you know, it's all available. So like everything from this meeting, everything from that, you know, Susan shared at the statewide training, it's all available on the website.
But I'm talking about the local areas that are doing things locally, where people are being shared. Not just, you know, this kind of rule thing, but stories, heart stories. That's what really gets to people.
And that's what great idea about.
Yeah.
And you know, that's a great little program.
We have a Spirit Empowerment Center, and they have something called Voices, and they're putting it on local television.
That's great.
So, you know, peers who are speaking, or family members.
And it's empowering. I haven't even seen it. I know it's empowering.
Okay, so back to the topic at hand, which is much less interesting than this topic. What are the qualities of a good presentation? Always introduce yourself and other speakers. Place them in context so that you know that what they say really matters. I really like having people in the room introduce themselves just so that you know, oh, you're from a small county too, or whatever. You know, so I mean, this is about as big a group as you can have and do that effectively. If you have more than 15 people, you can't do that really. your topic. When you're trying to make a change, make sure that you describe the current situation. This is what's happening today. You know, lay the context, lay the framework, figure it out so that people know. Because what you may think is today's current situation may not be what they think is today's current situation. So you have to lay the groundwork so you all start from the same place, okay? And then you have to describe the change that you want to make and what it looks like. And this is actually harder than people think it is. So you can't go in and say, today we have heroin addiction. And the change I want to make is I want to change that. I want it to go down. You know, that might be a fine thing to have in your head, but it is just not good, specific enough. You know, what you have to be able to say is we need a program that will effectively treat heroin addiction. That might be something that you want. You might want, if you were Chief Paletti, you know, the Chief of Police, you might want to encourage those people to move on to another city. You know, if you were the sheriff, perhaps you'd want them all to be in the prison where they couldn't get it. Do you see what I'm saying, though? So make sure that you know exactly what you're asking for. When you talk about public policy change, that is the way you make public policy change, is you know the direction you want to go. That's how come Steinberg was successful, because he laid it out. He said, this is where I want to go. This is what it would look like. This is what it would cost. This is where the money would come from. You know, these are the services we're going to provide to this particular target group. We're not covering everything. You know, I mean, he really boxed it up just in a great way, and it passed. You know, I mean, when you think about it, it's amazing that that passed. It really is. How lucky are we that that passed? And we passed because that was a real campaign for change, you know. So think about Proposition 63 when you think about change and making change. So describe the change you want and what it will look like, and then make your ask to the group. So if, say, you were selling Proposition 63, what might your ask be to the Rotary? To the Rotary Club. You're speaking to the Rotary Club, and you've described Prop 63, and you, whatever. I mean, what is, so you want it to pass, so what are you going to ask the Rotary Club? Ask them to vote for it.
Well, to vote for it, yeah.
First, you need to know what their focus is.
Right.
They're a service club. What are they serving?
And they're actually into polio, as it happens. But,
okay, so,
you know, so,
But you're not asking them.
would I try and sell, I would not try and sell Proposition 63 at the Rotary Club.
right.
On the other hand, I would sell polio inoculations in Africa.
Yep, exactly.
Or all these mothers who are not immunizing their kids today. I mean, I would sell that to the Rotary Club. I would say, what's going to happen if we have another polio epidemic? You know, what's going to happen in this country? You know, we need you to spend your money on polio.
I still would sell it to the Rotary Club because I think there's a percentage of the population that everyone is exposed to mental illness.
Sure.
Right, and I'm sure they've got families, they've got friends, they know people who probably have suffered from this, and it may affect them. So this is something that affects our community where we live.
Well, how does polio affect depression? There is a definite link between any physical illness with mental abilities.
Right. So I certainly would approach them.
Yeah. So, I mean, and that's fine. That's fine. And that's what I keep saying. Remember that I'm giving you one set of stuff, and that you would be comfortable approaching them. I might not be.
Right.
Arnie?
Approaching them for what? I'm not sure of the point. What you said, you sell it to the Rotary Club. The only thing I can imagine you want them to do is raise funds. I mean, the MHSA is a fact. It's there. It's in the community.
I was sort of using it as an example way back when.
Are you using it as an example of raising supplementary money?
Supplementary money. I mean, that's why I would go to the Rotaries for money, I think.
Or to vote. Let's say
Or to vote.
before the proposition. You know, it's going to be on November's ballot, and it's coming up for a vote. They vote, right? We want to say when this comes up,
I want your support.
And Rotary members do vote.
Yeah.
They're among the voting.
Right, their friends vote, their spouses vote, right?
And you can give things just for an informational. I can't believe the people in my county who don't even know we have mental health services. And we have really great people. I mean, we have people that live in Woodlands County don't know we have a library, you know.
Wow.
So if they don't know that,
Where are you from?
Alpine. Not a lot. Alpine is the smallest county in the state. We only have 1,100 people in the county. That's it. It's over east of Lake Tahoe. I'm about 20 miles east of Steuben. It's tiny. But just sometimes people need to know. I used to go and lecture people, or not lecture, speak to service organizations about hospice, because that was my career, working in hospice. People used to think that we came out and killed you.
What?
You know, you wouldn't believe it. Yes, you did. It's a 6-month program, but don't die in 6 months. You're gonna kill me?
Yeah.
Really? With a straight face. So people need.
Yeah, people need information. People need information. So I'm just going to kind of wind up here a little bit because I want to give you about 5 minutes. You do have an evaluation form. If you can do 2 things at one time, be sure and be filling out your evaluation form. Handouts are good. We talked about handouts a little bit. Always leave room on your handouts for note-taking. So if you have one that's totally filled out, you know, the whole page is filled out. I'm trying to find, like this. If the whole page is filled out, you know, indent a little bit on each side so people can write comments on the side and so on. Always do it to the degree that you can in black and white, especially if you give handouts to people that you want them to duplicate. Don't give them to them in color because it's really hard to copy a color thing and it ends up not looking right and you waste a lot of paper getting it just right and so on. So always do that. We talked about editorial boards. What about blogs? Does anybody use blogs at all? Anybody interested?
There's a blog in our community that we can actually put mental health stuff in, and it's better than the newspaper in one sense because a number of people use it, and it goes more in depth on issues, especially mental health and environmental justice issues.
Right. And we have one that was really where they ran literally 4 parts of it on suicide prevention, which was very nice during a suicide prevention piece. So blogs are potential ways of doing things. What about mail? Does anybody use mail campaigns? Lots of people use mail campaigns.
I have used them a lot.
Yeah. And so mail campaigns, you expect less than a 10% return on mail campaigns. You expect, 90+% to just get thrown directly in the trash without ever opening. So one of the new strategies is that you use postcards instead, because at least that way you can put a picture on it or a message on it, and as they're deciding to throw it away or before they throw it away, they see the message. So postcards can be a way to influence things or to advertise an event, right? Advertise an event. We're not going to do that. So I think I'll end here. You've got to be, this is Yogi Berra, you've got to be very careful if you don't know where you're going because you might not get there. And, when I talk about advocacy and community outreach, I hope that the message that came through, just to emphasize it for the 6th time before I shut up, is that you need to think ahead. It is not something that you do on the spur of the moment. You need to consult with other people. You need to put the pieces together. You need to know who your audience is. And you need to know how to manipulate that audience to get out of them what you want. Questions?
Well, I had one question earlier talking about the meeting and the public. One of the things that came up for us was how when someone comes and does a presentation from the public of some personal experience, what is exactly the right thing to say, or might you say, to let them know that you can't solve their problem right there, you're not the right body to do that, but you have heard them, and that what their presentation did will bring some kind of a response. So what's the right
What
verbiage?
kind of verbiage might you use? So I have somebody that's come and they talked about the services their child did not get. Let's take my brother, the attorney. You know, I think the most important thing is to provide them with the reinforcement that you did hear them. Thank you so much for sharing your story with me. You know, so that you reinforce, I heard you, it's important, it matters to you, therefore it matters to me. So thank you so much for sharing your story with me. Yeah, go ahead, May.
Well, we're a large county. However, I know when we have people that come in and have a problem, the director always says, singles out whoever's in charge of that program, the deputy director, and says, we'll meet with you afterwards. And then they have a special, session themselves, and we take care of the problem right at the time.
So that's an excellent way, if the director will pick up on it. Yeah, but the thing, as let's say you as the chair of the group, you could say, thank you so much for sharing your story with me. I know that the director is here and will help us find, will help us direct you to a solution or to the right person. So I don't think you ever want to say that you can solve the problem. No. I think you want to just can direct you to the right person to help you, something like that. And, if the director doesn't leap in, which the director should, if the director doesn't leap in, you can kind of light the fire under him by saying, the director's over here, and I'm sure he'll direct you to the person and talk to you about this problem.
One of the things
Talk to you about this problem is probably good lingo. Talk to you about this problem, not saying solve it, not saying fix it.
Situation or whatever.
Talk to you about this situation.
One of the things that comes up primarily for our director is that a lot of the families complain that they're not getting information, and that the family member who is ill hasn't gotten services. And the director knows that person did get services, but they can't tell the family member. Is there any way to deal with that you know of?
That's just it's a hard piece. I run into it in my business all the time. Families really want their kid to be clean and sober, and I can't tell them if they've fallen off the wagon. It's just a really, the HIPAA laws are really awkward.
Well, and it creates such a tension sometimes between consumers and family members when you have both on the board too, because family members, and in many cases rightfully so, are so concerned about their family member, yet you've got to remember that consumers have rights too, and that where the line is and the dichotomy is just, the tension that it can create.
And I believe that there's starting to be a change in mindset about that whole HIPAA issue, because more and more family members are placed in that position of not being able or not getting the information they need to help their family member, particularly when you're dealing with those that are severely mentally ill, right, and don't really have the capacity to make decisions for themselves. However, family's not in a position to really help them. That's right. There's a book out, I think the name of the author is Anthony Solomon. He's talking about depression, and he references the fact that we need to begin to look at perhaps softening those rules around HIPAA as it applies to severely mentally ill, because it's not working.
Well, that's one reason that Laura's Law has come up again.
Right. But also it depends on that. I agree with that, but at the same time, the concern for the individual's rights can't be put aside either, and that's where the tension comes.
Sure.
Yeah.
Sure. Yeah, you're right, there's a fine balance that needs to be struck, but right now I feel as though it's shifted too far in
On one
direction.
side, right.
And people are left with family members where we're in the position of wanting to help, and they're asking us to help them, but yet they just don't have the capacity to say, yeah, I'm going to sign this release.
Well, that's where Laura's Law comes in, with the balances that you have, because you don't want somebody that is a family member that might be, the problem too is that the reason that the HIPAA laws were put there, right, was that there were people in families that might be eccentric, but not mentally ill, and their family members put them in a position where they were then
it just seems to me we should be
over-medicated.
able to apply enough intelligence to a situation that someone should be in a position to say, you know what, I'm going to evaluate on a case-by-case basis that this is not an eccentric family member who wants to put their same family member away, but it's a situation where we've got a schizophrenic person who thinks that their mother, their wife is a demon and wants to poison them and not allow that person to speak with someone because of the HIPAA rule.
Right, that's where the tension is, though. Where does it you have to have a significant evidence that the person is a threat to themselves or.
And there's a waiver mechanism. There's a waiver mechanism that clients can sign. Arnie, did you have a comment? Or?
Well, since I wanted to go a little bit different topic in the commentary phase here, to go back earlier, we had a prior discussion about new members, about bringing and orienting people, and I wanted to make the suggestion that the next time you have one of these, that there should be allow each county to bring an additional person.
Okay, I'm looking at Shoshana.
First of all, you've got empty chairs. You've got a big room. You could have 2 or 3 times as many people here today without increasing your costs. And then they would be able to eat all the food that was.
Yeah, there's food left over.
Yeah. I'm sorry, but we did have a number of people that didn't show up.
Can I finish, please? I would suggest that you, first of all, you strongly advise the paid directors of mental health services to see that somebody comes, so you don't just have. There are a lot of counties that are not represented apparently, unless they're all on the web. Okay.
Yeah.
Okay. So to get a little bit more pressure to get good attendance, the mental health services director should be responsible to. If they can't get someone, they ought to show up themselves. And you make sure that you have one from every county, and you bring along one new member in addition.
Yeah, welcome
Okay,
to
so we were
all the
talking
new
about
people that are
earlier,
here.
And then you would have 3 times as many people in the room as you have now. More counties would be served, and you get better utilization of the space. And
Did you put that on your evaluation form?
No, because I didn't know I didn't know that there was really a place for that, but I just wanted to bring it up to you because I think this is very valuable. I think this is worth my day.
Thank you.
But I sort of
I'm glad to hear that.
wish that there had been another person. We were talking earlier about bringing new people on, and what better way to orient new members than to come here. So that would double it from the county, right? And then the last part was the accountability of put the onus on the director. Do you get somebody or you come yourself?
Got it.
Okay?
Yeah, I concur with you about getting new members, like getting one new member, someone that hadn't been there for a year, or someone, and coming, because this would be a great tool for them to understand. I'm not sure that I agree with the mental health services director, because as the board, we have to work with them, but we also kind of want to keep our independence.
I understand. Well, I was only saying that in reference to trying to get them to urge someone to show up.
So to show up, oh, okay.
I agree with you. They probably don't belong here. Ideally, should be a representative, just like I'm the vice chair and the chairman
I'm going to let
asked
her
me
go
to
first
come.
and then you.
So anyhow, I wanted you to know it's very valuable, and I think it would be good if we had more people. It would be great.
I just said I wanted to double what Arnie said, because the other person who should have been here today with me is Amanda Wilcox. She's the mother of Laura, and she's the one who spearheaded Laura's Law, and she's a new member of our board as well.
Wow, yeah.
Because
She's been on the webinar.
Is she on the webinar? Great. Okay.
That's great. And May had a comment.
I don't know if all of you are aware that we do have this organization. It's the COMBOARD, the California Local Behavioral Health Commission. And what it is actually, well, we have actually 26 members who are allowed to come. So we can only represent 26 counties. However,
Well, actually 21 because 5 members are from LA.
well, that's true, but that's true. However, we have an annual meeting which is coming up this month, and it's going to be in Burlingame. And for those of you who are in counties that have paid your dues, you should have an invitation that you are allowed to come or you expenses paid. Now, I don't know if any of you are aware of this or not, but anyway, anyone is allowed to come. You don't have to. If you come, often if you talk to your mental health director, they maybe will pay your way to come to this meeting that we have quarterly. And I think there, and we used to have quite a bit of time to set aside for all the questions you're having.
What's the name of the group again?
California Association of Local Behavioral Health Boards and Commissions.
And so, many of you want to know,
This is a different organization?
No,
Yeah,
they changed their name
that
from
actually
mental
leads
to
me-
behavioral.
That actually leads me to a
Well, we
question
went
that
to
I've had
San
since
Diego
the,
that did that big old presentation
the
where they
beginning.
were sitting around
in Prop
tables
63,
Oh,
in Prop 60,
Yeah.
That's
Where-
great.
we have the California, so we're or not Prop 63, but in the statutes,
Right.
the local county mental health board.
That's right.
Right.
Do we have the ability to change our name to a behavioral board? I mean,
Yes,
aren't,
yes.
if we
And
do,
yes,
that's in the statutes?
Absolutely. Absolutely.
Why would
That's up to your county from local. Oh, there are a couple of counties that don't want to because they haven't combined their boards.
But to this gentleman's point earlier to that too, doesn't that kind of take away from the mental health portion of the expertise of the?
No,
Well, some people think the opposite, that it takes away from the substance use treatment.
well, substance use, from the federal government, substance abuse has combined with the mental health. And so it now has become a behavioral health. I know we've been behavioral health for way before this was even planned on.
I just wonder if that's.
Anyway, no, but any of you who are interested
I'm not
in the
sure.
things, the problems and the questions you're answered, I think, you might be able to have a better audience, more people there. I think a lot of you come from counties that probably haven't ever sent someone to our, to our COM board. So,
But if I-
Excuse me, when is this?
well, it is coming up, and we meet in conjunction with the planning council. The planning council is the 15th, 16th, and actually they have the 2 days before.
You're at the Doubletree?
Yeah, it's a DoubleTree in Burlingame, and what it is Burlingame.
You said Burbank. The 18th.
Burlingame. It's on
Okay, not
San
Burbank.
Francisco Airport.
Yeah, I understand.
And so, anyway, but we have, pardon me?
It is.
Well, the dates are for the
It's a weekday though, right?
Thursday night.
Their board meeting is on Saturday.
18th,
Yeah, but the conference is
And the call board is the 19th and 20th.
Well, we meet the first day of the last day of the planning
Right,
council.
which would be the 19th and the 20th.
And then the 20th, but then actually, the day that we would, we will have our annual meeting will be this Saturday.
I can't hear May.
Yeah, I can't hear either. So
Yeah.
could you repeat all that?
Well, what do you want to know? The date?
What,
Okay.
I would,
19th
okay,
and
so
20th. Our planning.
what's the name of the group again?
It's the COM board, which is the California Local Behavioral Commission, boards and commissions, behavioral health commissions and boards.
Okay.
Because many counties consider themselves commissions, many of them consider themselves boards. So that's just one of those things. But we meet generally the same time the planning council meets. Now, Jamon's here, she's in charge of that. We meet, actually, some of us come in because I like to hear what's going on in the planning council. But the last day of the planning council, which is generally in the morning meeting, our president then gives a report as to what we've been doing on the COM board. And then the meeting is over at noon, and then from 1 o'clock, then we meet. We meet actually during the afternoon or after 1 o'clock, and we often meet in the evening, and then we meet all
all-day Saturday. And Saturday is when we will have our annual meeting. And that's where we, and, you know, we have new officers that we appoint, and every year we have that. So, and if we have any bylaw changes, that's when we have that. So
is there any expectation that within this MHSA money that's going to the counties, that there's monies for this sort of thing?
no, well, we've been battling for money for, I know, 20 years, because I've been involved in this for 20 years. So anyway,
there's not a separate account there for that?
No,
Because
if you want to come, often your local behavioral health will, you know, have monies. They have money from the state, and some of them. Now, this one lady here.
So you're not paying for anybody this year to come?
Yes, we're paying for those who pay their dues.
So if you are in a county that paid their dues, the dues are, this year we're $500. $500.
Yeah, we had to go up to 500
Okay.
because
the dues are $500.
Right, and then they would pay for somebody to come.
But just
we get an invitation when we send out our dues
letter.
Accommodation.
Right. They would pay for the accommodation.
They would pay for your fare or whatever.
Just one person.
So the county's already paid for dues. They can send like that.
Right. Or, but you can still come anyway, because your county will pay for it if you want to pay for it. So anyone from any board is allowed to come, but, you know, you're all from small counties and
you're gonna be there.
Oh, yeah.
May.
I also belong to that same organization. I just like to second what she says. It's an excellent organization. It's worth your time and effort. And what it does is for me, it kind of functions as a support group for local members, where you go there and you talk about a lot of the problems that we experience. And do other things.
A lot of the questions that
That's kind of what I was getting at. Yeah.
The roles and duties, we probably can sort out there. We have not had a lot of time to do individual things, but we are going back to.
Jane's business card, my business card, if anybody wants them. My email address, Susan Morris, MORRS, Wilson@gmail.com. It's an easy email address. If you have a question or you need something from me, please feel free to email me. Okay?
Thank you.